standards from our steering committee that just kind of, thanked him for introducing it, but just reminding him that HR 676 from this is a gold standard and outlining some of our basic concerns with us. Express what our concerns are here in the office.
My name is Ellen Barfield. I live in Baltimore, Maryland. I want to make the point that I actually participate in a single-payer system and get good health care for various chronic conditions which I need ongoing care for. It's called the Veterans Administration. Sadly, even the VA is not totally single-payer because not all vets have access to it, but those of us who do get all of our care in one place. If we need another doctor for another specialty, it's down the hall, and maybe a few weeks wait. But it's so much easier than having to bounce all over town and not sure you're going to get anything. So a lot of us veterans are saying, make VA for everyone, but improve Medicare for all. That works too. Everybody in, nobody out.
Hi, my name is Ed Klein. I'm from Freeport, Illinois. I thought I was lucky when I got on Medicare. Unfortunately, my prescription drugs aren't covered. So since January, I've had no coverage of my would be out of pocket for my drug, which is a biologic, would be $10,000. And there's no way that I can afford that. And I really believe that the insurance companies in healthcare have no place, that if we leave them in for any length of time, that we are absolutely going to it does not help the system move forward.
My name is Phil Ateto. I'm from Annapolis, Maryland. And Senator Sanders might not recall, but several years ago, the Backbone Campaign, our organization, gave him an award for having the moral courage to stand up for what's right. And as a strong Senator Sanders supporter, I feel like it's part of my responsibility to also hold him accountable when he falls short, as his single-payer bill does in many ways, or several ways at least. As grassroots activists, we're doing the work of educating people about single-payer health care, but right now we need Senator Sanders' renewed resolution to stand firm and with a stiff spine, so to speak, with a single-payer bill that meets the gold standard and gives Americans the health care system we deserve. Greatly helps us, in our grassroots activism to have a bill that we can enthusiastically champion in our work, and it meets the gold standard. HR 676 is that bill, and I'm urging Senator Sanders to introduce a matching bill in the Senate.
My name is Mike Pappas. I'm a fourth-year medical student here in D.C. I'm going to be practicing family medicine in about a month in New York. So I'm here to let Senator Sanders know that, I'm thankful that he introduced this bill in the Senate, but the bill just doesn't stand up to HR 676. Working in the healthcare system, I see how the profit motive and the profit incentive just corrupts everything about our healthcare system. And if we're going to have a healthcare system that truly actually covers everybody, we need to do things like eliminate investor-owned facilities.
I'm a spinal cord injury patient, as well as being multiply handicapped. And when HR 676 first came out, I was delighted to see that it included long-term care as part of the bill. And I was delighted to see when Bernie Sanders came out for a Medicare for All bill. And then when I investigated the bill, I was surprised and devastated to see that it didn't include long-term care and that was left to Medicaid like it is now. And I'm just here to ask him to come through with his conviction that we need to overcome income inequality and serve the people, and to please bring his S-1804 in line with HR 676 to include long-term care and keep private institutions out of it also.
My name is Jody Koss. I'm from Northern Illinois, and I'm actually a nurse, and I'm really worried about the part of Bernie's bill that allows for private for-profit facilities to remain in existence. I have a son that he's 39, he has a lifelong problem with mental illness, and I'm just really don't think that there's any room at all for for-profit facilities in the United States, and there doesn't need to be. There is an answer. I just fully, even though, I'm really happy that Bernie has supported some type of universal health care. I really want him to look at the HR 676 and align his bill with that one.
So I wanted to tell two stories about my mother and father. My mother's 89, my father died last year. The two problems they have, affect millions of people, and they're not fixed by the current draft of the Sanders bill. My father had a stroke about a year ago, and he was left debilitated. He couldn't feed himself, couldn't walk, and under Medicare they have provisions where if you're not making progress after a certain amount of time, a very short amount of time, they decide to send you home. And my father was sent home and was in a position where he couldn't feed himself, he couldn't walk, and my mother, who was 89 years old, had to take care of him. That is an all too common problem, and that's because Medicare does not cover long-term care. If he wanted long-term care, he'd have to somehow get rid of all of his assets, sell his house, and be a pauper in order to get the care he needed. Medicare didn't solve the problem. We need to have an improved Medicare system that includes long-term care, and the current Sanders bill does not do that. It's a major shortcoming that will affect millions of people. My mother, who's 89, as I said, is on traditional Medicare, original Medicare, and has some supplemental for drugs and such. But she was at a senior center, and a salesman came in to sell her Medicare Advantage. Now, Medicare Advantage is really a disguise for the insurance industry. It's an insurance industry ripoff. They come in saying, we cover more than Medicare does, we're cheaper. But the reality is, the studies have shown that just like with traditional insurance for non-seniors, Medicare Advantage rips them off. Senator Sanders' bill has this very complicated 4-year transition period, which will allow Medicare Advantage to become further ingrained in our health system and be very hard to remove when we put in place a true single payer. So I urge Senator Sanders, right from the outset of the transition, no Medicare Advantage, no insurance industry allowed. Thank you, Senator Sanders, for introducing the bill. Now we need to work together to improve it.
My name is Dr. Margaret Flowers, and I'm a pediatrician. I practiced for 17 years. I left practice in 2007 because I was being driven to spend less time with patients, and I was constantly fighting with insurance companies, and that's not how I wanted to practice medicine. Now, 10 years later, the situation for doctors is even worse than it was for me back then. Under the MACRA system that we have, doctors are paid based on how well their patients do. And this creates a very perverse incentive that incentivizes doctors not to treat patients who aren't going to do as well as the other patients. Or if they're not willing to participate in that, they're driven into these HMOs or ACO type systems. And so all of this is preventing physicians from being able to spend the amount of time with their patients that they need because of all of the paperwork involved, and it has the wrong incentives for them, and it's undermining our ability as physicians to treat the individual patient based on what their needs are. And so I was really sad to see, as a longtime advocate for HR 676, that Senator Sanders' bill ingrains these same systems. I'm saying to you, Senator Sanders, we're seeing even faster burnout of physicians right now, especially primary care physicians, and your bill is going to continue to worsen that trend. So this is something that we really need to take out and use the provisions that are in HR 676. Tens of thousands of people are dying every year because they can't get access to care. And so Senator Sanders has put in a 4-year, delayed transition kind of plan that's going to continue our current system for 4 more years, even after we get the bill passed. That's going to translate to tens of thousands of more deaths. So I'm saying to you, Senator Sanders, make your bill the same as HR 676 or stronger, and let's do it the way every other country has and the way we did it in 1965 with Medicare, and implement it right away in 1 year. Everybody in at the same time, nobody out.
I'm Mark McKinley. I'm with Kentuckians for Single Payer Healthcare. I really applaud Senator Sanders' positions on the environment, on income inequality, and on raising the awareness about a single payer system. But what we need to do to help poor people, every American family, have more money in their pocket is to eliminate co-pays, get the corporations out of healthcare so folks have more money in their pocket. Senator Sanders, as long as you keep the corporations in this, that doesn't help address the income inequality that you speak so well about. We need to get the corporations out of this, and we need to do this in a timely manner. An incremental approach just allows more inequality to grow in this country. Senator Sanders, thanks for your work. Please adjust your bill to more closely align with the bill in the House 676. Thank you.
We're going to share this video with Senator Sanders' staff so that hopefully Senator Sanders will see this video and hear our concerns and know that each one of us is speaking from the heart about the real impacts that we and others will experience if his bill goes forward as written. We want to work with him to strengthen the provisions in it.
Somebody's hurting my brother and it's gone on far too long. It's gone on far too long. And it's gone on far too long. Somebody's hurting my brother and it's gone on far too long. And we won't be silent anymore. Somebody's hurting our people and it's gone on far too long. It's gone on far too long. And it's gone on far too long. Somebody's hurting my people and it's gone on far too long. And we won't be silent